Hi Mike, many thanks for letting me use you to demonstrate venipuncture. We're going to use the vacuum tube method. It's the safest, a totally enclosed system, and the most economical. It's also a favorite because multiple blood samples can be taken in a short period of time from one puncture site. Each of these vacuum tubes has a different colored stopper. Each colored stopper, except the red one, contains a different anticoagulant or additive which keeps the blood from clotting. Once you're ready to begin, you're going to screw the needle into the plastic holder. Insert the tube into the other end of the holder. The top of the color stopper should reach the thin guide on the holder. Don't press the tube. If your tube exceeds the thin line, throw it away because it may not have a vacuum. Mike, have you ever fainted before?
No, not that I can remember.
Well, I'm going to ask you to stretch out on the table anyway. Is one arm better than the other for finding a vein?
If there is, I don't know.
Okay, well, we'll just use the right, okay? Next, put on exam gloves. And place the patient's arm in an extended position with the palm facing up. The tourniquet goes about 2 inches above the antecubital space. The antecubital space is here, where the upper and the lower arm meet. Place the middle of the tourniquet on the elbow side like this. Crisscross the ends, and while holding one end stable, tuck the other end in. This creates a tie that can be quickly released with one hand. Next, palpate the vein with your fingertips like so. If you can't feel a vein, try the other arm. Prepare the site with an alcohol pad by rubbing in a circular pattern beginning at the insertion site. Then stabilize the vein with your non-dominant hand 2 inches below the insertion site and pull the skin towards your other hand. Now you're ready to insert the needle while holding onto the holder with your dominant hand. Insert the needle bevel up smoothly and rapidly at a 15-degree angle with the bevel up. The needle only needs to be inserted just past the bevel.
When you insert the needle, don't push it in too far because you can puncture both vein walls. Also, it's key to keep the needle in line with the vein.
While stabilizing the holder, push the tube into the holder. Use your thumb and middle finger to push the tube into the rubber sleeve. The vacuum tube automatically fills to 3/4 full. Once the tube is filled, remove it carefully without moving the needle and apply a second tube if needed. Always roll the tubes 5 or 6 times after you remove it to allow the blood to mix with the additive. Once you've inserted your last tube, immediately release the tourniquet, remove the tube from the rubber sheath, and then remove the needle while covering the site with a gauze square. Okay, Mike, you're going to need to apply pressure here just for a few minutes. While Mike is holding the gauze, attach the safety cover and discard the needle in the sharps container. Then gently rock all the tubes 8 to 10 times in a figure-of-8 pattern. This is to mix the samples. And don't forget to check on your patient. How you doing, Mike?
Fine.
Let's keep the gauze on for a little longer, and then I'll apply a Band-Aid. There you go, Mike. You can leave whenever you're ready.
What about the results?
The doctor will call you in a couple of days.